I recently had the privilege of speaking with Dr. Christopher Hostler, Associate Chief of Staff for the Medicine Specialty Service at the Durham Veterans Administration Healthcare System. Duke's partnership with the VA is crucial as it enhances educational and research opportunities while improving patient care for veterans and our broader community. Chris, it's so good to be here with you, and congratulations on your new VA leadership role.
Thank you.
I can say I really knew you when you were an intern. But I know personally how important and how just special this relationship is between Duke and the VA, but not everybody understands that. Can you speak a little bit of what the benefits are?
Yeah, I think we have a really unique relationship between the Durham VA and Duke. If we look at most VAs around the country, even those with academic affiliates, they have their VA faculty and their academic faculty. And I think our partnership really stems from having a shared faculty. If you look at our VA faculty, the overwhelming majority of them are part-time VA, part-time Duke. And that helps us because our patients know that they're getting the same world-class care that they do across the street. And it helps Duke because 8% of North Carolinians are veterans. And so you're seeing a lot of veterans, and your clinicians are already aware of all the unique health challenges that they face. From a research perspective, we have additional funding pathways for interested researchers through career development awards and merits. And actually, because of this unique partnership, Durham has been more successful than any other VA in terms of acquiring CDAs and merits.
Well, my whole career started as a VA.
That's right.
Initial early investigator award, so I really appreciate it. And you and I both trained.
That's absolutely right. Yeah, and training is a huge portion of our mission too. And medical students, allied health professionals, residents, fellows, medicine residents spend 40% of their time over here. And we fund those residents as well. So I think it's an important partnership and one that VA is invested in, and certainly Duke is as well.
So you are unique in that you're a veteran and have had prior military experience, and now your leadership within the VA. How does that experience inform your role?
Yeah, if you couldn't tell from looking around the office, I went to West Point for undergrad and came here for medical school after being medically discharged from the Army. And one of the reasons I came here was because of the Durham VA and an opportunity to continue to serve. But I think something that the military does really well in terms of it provides young leaders with expansive leadership opportunities, right? You look at a company commander who's typically in their mid-20s and they're commanding 150 soldiers. Those are opportunities that aren't necessarily reflected in other sectors. And I think that has really helped me when, for instance, I was the hospital epidemiologist at the beginning of COVID and was asked to run our COVID response. And we were really successful. In fact, we had the most successful COVID vaccine campaign in North Carolina, public or private, as well as throughout VA nationally. And certainly wasn't all me. We had a great team, but I think that those lessons that I've learned through the military helped me be able to lead during that time.
And by the way, you're a great chief resident, which is a major leadership role.
That's right, thank you.
But in order to stay as we are, we have to change.
Yep.
So what is your vision looking forward in terms of this relationship?
Well, first and foremost, I want to maintain this relationship. And that's not just a stagnant, something that we need to continue to just keep in stasis. That's something that continues to need ongoing work because we are fundamentally two separate health institutions that sometimes have different priorities. But so it's a lot of work to maintain that relationship, but I think it's really important. And I think that, for instance, right now, we're in the very beginning stages of planning for a new hospital. We have a 75-year-old hospital here. And fundamentally, our leadership group at the VA understands that our proximity to Duke is important because it helps us maintain that relationship as well. So despite the fact that we care for veterans all the way out to the coast, it's really important for us to maintain this academic affiliation, and it benefits our veterans, it benefits our clinicians.
So the challenge is, how do we maintain what is so special but recognize new needs and certainly a growing population of veterans?
Exactly, exactly.
So Veterans Day is coming up. How would you like to see members of the Duke community honor our veterans?
That's a great question. I think the general impulse is on Veterans Day or whenever you see a veteran to say thank you for your service. And I think while well-intentioned and certainly sincere, it also tends to cut off the conversation a little bit.
Yeah.
I would encourage people to ask a veteran about their service. So towards that end, this is a way for me to give a little plug for Medicine Grand Rounds on November 22nd, available on Zoom or in Duke North 2002 at 8 a.m., where we have the 6th annual Veterans Experience Grand Rounds. I'll bring 3 veterans, different branches, diverse experiences, and just ask them to share for 10 or 15 minutes some of their experiences in the military. And for them, it provides a little bit of catharsis, and for the audience, they get a little bit of understanding about what being a veteran is like. So it helps them forge a deeper connection with their veteran patients.
And we learn so much from our veterans. So thank you for all that you do.
And thank you for our ongoing partnership.